Can you all hear me?
Yes.
Okay, so I'm Dr. Ronke Fakunle. I live in Leeds, but was obviously called to Barnsley a few years ago, and I work as a GP in Hoyland. As Sister said, I'm currently on maternity leave, and I feel it's a real privilege to be able to speak with you this morning. And so let me explain my journey. So I grew up in a family where I went to church for Sunday school every now and then. My recollection is that my dad would drive us to Sunday school and then he'd come and pick us up later. And I think it was really more of a way of getting us out of the house, to be honest. But I'm glad that we had that opportunity because it gave me the chance to learn about God. And as a teenager, I then had more questions and wanted to know more about why. What's the purpose of this life? And as my life has grown, I've seen God do wonderful things in my life. I've been through all sorts of ups and downs, and God has shown me how faithful He is. I also have the privilege of being a doctor. Again, it's a huge privilege. It's a huge privilege to be able to sit with somebody, to be able to listen to their problems and to help God, to help be part of helping God to help with their healing. As we sung earlier, God is the healer, but we as doctors are sometimes privileged to be able to play a hand in healing. So actually, I've titled this, it's Women's Health Talk. I want to talk about how you can stay healthy and how you can keep people like me away from you. So I wanted to first of all think about, what does the Bible say about health? So we are told that the human body was created by God. So if it was created by God, we should respect our bodies. And we need to be striving towards spiritual health, which is why we pray, we worship, we read the Bible. But we also need to be thinking about our physical health. And that's where I think I come in. So I'd like to also think, what's the #1 killer of women in the UK? What illness is the #1 killer? Any ideas? Possibly. Yeah, possibly ovarian cancer, possibly heart disease. So those are things that come into mind. Okay. So these are things that I planned to talk to you about today. So talking about cancer. So just very briefly, what do you know of cancer? What is cancer? It can be, yeah. Because I always think it's interesting as a doctor to kind of understand what people think of things, because that probably makes a difference to whether people take the medications, whether they do things to prevent them and things like that. So, a deadly disease, what else do you think of cancer? When you hear cancer, what does...
You can use this also. People are, yeah.
Okay. All right. So I've used this slide here just to show you. If you look on here, the sort of donut-shaped red cells are normal red blood cells. And then in the middle, you've got this one that's got sort of funny white bits on. And what this is trying to illustrate is the red blood cells are normal body cells. So that's what you'd want, nice, healthy cells. But in this picture, it's showing an example of some cancerous cells that have appeared and have started multiplying. And that's what happens in cancer. Our bodies are constantly regenerating, constantly remaking the cells. And they're doing it without us thinking. As you're sitting there now, your body is rebuilding all sorts of different cells all over your body. And what happens with cancer is one type of cell in one part of your body suddenly produces a strange one, and then that one multiplies and becomes bigger and becomes cancerous. Okay. Does anybody have any idea of what anybody's lifetime risk of cancer is? So what are the chances that in your life you might get cancer? Okay.
The beginning of cervical cancer. I get to lose the baby because of it, otherwise we would have both died. And going back in the family, lots of people.
Yeah. Yeah, so you know you've got genetic reasons that your risk might be higher.
My dad also had a prostate cancer, but I was a man.
Yeah.
I was in my 20s when he had cancer, and he died 5 years later.
Fortunately, you haven't got prostate, so you can. Yeah, brilliant. You should be in medical school. So, yeah, what do you think of that?
That's high.
That sounds high, yeah. Yeah.
I feel we age back people women dirty.
But probably lots of reasons. We're living longer now as well. So as we live longer, these cells are constantly regenerating. They make mistakes every now and then. The longer you live, the more time they have to make a mistake and do that. So lifetime risk is about 50%, 1 in 2. But the whole point of doctors is that some of these are preventable. There's nothing we can do about our genes. I have the parents I have the genes I inherited. I can't change that now. But there are lots of things that we can do to prevent some illnesses. And about 38% of cancers are preventable. That's hope. In terms of female cancers, the most common subtype is breast cancer, and then followed by lung and bowel. Okay. Other cancers fill up 46%. So the most common single cause is breast cancer. And this just shows the estimated risk of developing breast cancer. So as I said, just to reiterate, if you make changes to reduce the risk of cancer, we think that there's a 38% of cancers, you can actually reduce the risk. Okay. Right, so you correctly said that the most common cause of death in women is heart disease. And so the reason I asked about that is that people think of heart disease as a man's disease, but it is actually also the #1 killer of women in the UK. And heart disease actually kills more than double the number of women yearly than breast cancer. And when we think about heart disease, there are lots of things that come into that. And I'm not going to go into specifics, but things like coronary artery disease, which is blood vessels around the heart, atrial fibrillation, which is to do with how your heart beats, stroke, or brain attack, if you think of it like that, heart attack, and heart disease that you might be born with. Okay. So as I said, this, should I just put him on my back?
Do you have milk for him?
No, I'll just put him on my back. He's fed already. He just wants to go to sleep.
Do you have a wrapper?
Yeah, yeah. Sorry.
Yeah, you have it.
I can put him on my back. Is he asleep? Oh, okay, okay, right. Okay. So so yep, that's so this slide probably is the crux of what I'd like to say today. It's for us to be thinking about the things that we can change that can give us extra hope. So for heart disease, the things that we can change are stopping smoking, reducing alcohol, watching our weight, lowering our blood pressure, reducing our risk of diabetes, thinking about lack of physical exercise as well. So actually, I wanted to give you out something with the cancer one. This is one that comes out for everybody. So this is a poster, again reiterating about that 4 in 10 cancer cases can be prevented. And what they've done on this diagram is they've put different things that you can do to reduce your risk of cancers. And they've done them by size. So if you look at the circles, the biggest circles are the things that if you can stop, make the biggest difference. And the smaller ones are things that if you can stop, they make a difference, but just not as big as the biggest ones, okay? So the absolute biggest one there is to stop smoking. And that makes a huge difference, okay? The next one is to keep a healthy weight. That's probably one of the hardest things. Yeah. And I'm sitting here 6 months after having a baby, knowing I'm wearing clever clothes that are pushing me in, and I know I've got extra weight myself. But it is an important thing for all to think about. Being safe in the sun. Today, that might be an issue, which isn't normally an issue, and we're grateful for it to be an issue, but it's knowing that we need to protect our skin. Avoiding certain substances at work, such as asbestos, HPV, making sure that you have regular smear tests. H. pylori, so if you're getting reflux, seeing your GP about that, and perhaps getting a test to check for H. pylori. Drinking less alcohol, eating a high fiber diet. So just eating more fruit and vegetables could make a huge difference to reducing your risk of cancer. Avoiding unnecessary radiation, cutting down on sausages, avoiding air pollution, breastfeeding if possible, being more active. I want to believe that was higher, and minimizing HRT use. Okay. So those, I'd like you to keep this sheet because I'd like that to be a poster for you to remember, and to keep looking at for your own, think about yourself in terms of what can you do to prevent, to give you that extra hope in terms of preventing cancer. Okay. Right, so how to lose or stay a healthy weight. So these are the kind of tips that we give in the NHS. Plan your meals. We all know what happens if you haven't planned your meal. Yeah. So if you go home and you're hungry, what do you get? Biscuits, crisps, chocolate. We all do it. But if you have a plan, you've perhaps booked your supermarket delivery, you've written your meal plan on the fridge. You're less likely to do that because your brain doesn't have to think, it's already sorted. Even planning snacks. It's perfectly healthy to have snacks, but plan healthy snacks because you'll need them. One of the things that I like to do at home, because of my children, is I have a fruit delivery once a week. And the children know this. So there's 2 boxes of fresh fruit arrive every Wednesday, and as soon as they come home from school, that's the first thing, they all pick whatever is their favorite fruit. And that delights me because I know actually, because they know it's there, it stops them walking past and going to the cupboard to get biscuits or look for crisps. So, and it's about thinking about how we affect our own behaviour, really. Don't skip meals. We often think that skipping meals is a good way to lose weight, but actually if you skip a meal, your body thinks you're starving, and therefore it slows down. And then when you do eat, it stores it a lot more. So actually it's better to eat regularly. As I said, don't stock up on unhealthy snacks. So instead of buying crisps and biscuits, buy fruit, rice cakes, plain popcorn instead. Okay. So I seem to remember there was a program on television where they were teaching families about healthy eating. And I remember watching, they went into a family and they opened the fridge, pulled out the fruit, the salad drawer, and it was full of chocolate bars. If that's how your vegetable drawer looks like in your fridge, that might be something to rethink. Okay. But on the other hand, don't ban food. Don't ban certain foods. It's all about moderation, because if you ban these things, all that happens is that you crave it even more. Yes, you can have some chocolate, as a treat at special time. Okay. Smaller plates as well. We've got plates have got bigger and bigger. And I know also in my culture, it's not just about the width of the plate, but how high you pile the food as well. But actually, it's not, it's not healthy, and we need to start re-educating ourselves as well. I really like the food labels that they started a few years ago, the traffic light system. I find that really useful, because it's so hard to remember what percentage of salt or carbohydrate you're supposed to take. But we all understand about traffic lights that if it's red, we really need to minimize that. If it's green, as much as you like. So just keeping an eye on those may even help you decide which one to pick. Because actually, if they're 2 tins of baked beans and they're about the same price, decide to choose the one that's got lots of greens rather than one with the more reds. And in just little ways, you're affecting your health. And keeping active. It is really hard to do that, and I think that's something we need to look at, how we can encourage ourselves. And it's not about punishing yourself, but doing what you enjoy. Keeping active is good for your physical health as well as your mental health. So I want you to just think for a few seconds about what changes you could make to stay a healthy weight. Okay. So a few seconds.
Ronke, staying active. Would you class, if you're on the go in the house and doing things, do you class that as an activity? Or no, it's not classed as an activity?
No.
You've got to walk.
Yeah, so this is the thing. It should be, because the thing is, you might do more activity than I do normally, but it's similar to what I was saying about missing meals. Your body gets used to what you do and just adjusts to that, and that becomes its sort of baseline. So what you have to do is do something that's a bit more than what you normally do. So alcohol. Too much alcohol can affect our health. Sorry, it's not very clear. I really like visual things. So I wanted to have these pictures to sort of help you think, what can you do? Why does alcohol affect your health? Because I think if people understand the why, it's then easy to then help yourself stop. Okay. And I wanted to just show it can affect so many different parts of your body. So it can affect your pancreas, it can lead to high blood pressure, it can lead to liver disease, irregular pulse, infertility in men and women. So lots of different things. So it is really important to cut down on alcohol. How to cut down on alcohol. So if you drink more than 14 units of alcohol a week, and 14 units is about 6 pints of beer, which actually isn't a huge amount, or 10 small glasses of low strength wine. When I talk to people, I can see how it's easy to do that. So if you're having a glass of wine a day and that goes up to 2 glasses of wine a day, it's very easy to be getting past the level that we would recommend. And the ways to think about how to do it are perhaps limit your alcohol budget. So in the same way as limiting your chocolate budget or your crisp budget, saying to yourself, I'm only going to spend this much a week. Let friends and family know what you're doing as well, so that people can support you and you can work on it together. And then also just taking it one day at a time. Perhaps thinking about having a lower strength drink or drinking water instead. So it's simple measures. High blood pressure. This is my, I don't know what the word is. This is my passion. So I often hear, probably because of my skin color, I know in my ethnicity, high blood pressure is a common thing. I know for myself that I'm almost guaranteed to have high blood pressure as I age over the next few years. And every now and then I'll hear that such and such a person suddenly died, and they suddenly dropped dead. And often it's related to uncontrolled blood pressure. So this for me is a slide that I really, really want people to hear. Because after a prolonged period, untreated high blood pressure can cause all sorts of problems. Heart disease and related complications such as heart attack, stroke, brain attack, and heart failure. So these are just some of the things that high blood pressure can cause, okay? This is why when I see patients, I say, please take your blood pressure medication. It's not because I get any shares from the drug company. It's not because I enjoy giving people drugs that might give them side effects. But when I see somebody's high blood pressure, I see these complications. Okay. So, hope. How do we lower our blood pressure? Okay. Regular physical exercise. So we're all going to try and exercise more. And with our busy lives, it's really hard to see how to fit that in. So it's recommended that we do about 150 minutes a week. So there are lots of ways of doing that. So perhaps if you did, so I put a 10-minute bout, but what if you did 15-minute bouts? You'd only need to do 10 in a week. So twice a day, 15 minutes. Does that seem achievable? Yeah. It probably is something you could put in your diary and specifically say to yourself at 10 o'clock and at 6 p.m. for 15 minutes, Monday to Friday, I'm going to do 15 minutes of exercise. Something that makes my heart beat faster and makes me feel out of breath. Doesn't have to be going to the gym and spending money. It could be anything. A brisk walk, but 15 minutes, Monday to Friday. That could be something we all agree to do. All of us. Okay. Trying to keep a healthy weight as well. So whatever you need to do to get your weight down, that will lower your blood pressure. The reason is that your blood pressure is about how hard your heart is having to work to get that blood around your body. The more of you that there is, I keep holding myself as I talk, the more of you that there is, the more pressure your blood has to put on it. So if there's less of you, that helps lower the blood pressure. And actually, it may be that lowering your blood pressure in itself may mean that your blood pressure lowering your weight may mean that your blood pressure goes to normal. Eating a balanced diet, fruit, vegetables, lots of fiber, reducing salt. Okay. And I say in my culture, and because that's how my mom raised me, we really need to look at how much salt we eat. I know we use a lot of stock cubes, which we don't realize how much of stock cubes is salt. And it takes a while to retrain your tongue from what you've done since you were a child, but it makes such a huge difference to your life. In the same way with salt and with sugar, just trying to retrain your tongue and needing to do it as a whole family, so it doesn't feel like it's a medicine just for you, but it's a lifestyle change for the whole family because of the potential health benefits. We've talked about reducing alcohol, and I've left it till last. Please take your prescribed medications, because actually, as I said at the beginning, the longer you have high blood pressure, the more damage that high blood pressure can do to your body. If you lower the blood pressure, this is what I often try and negotiate with my patients. If we lower your blood pressure and then you do all these other things, if your blood pressure is then normal, we could look at perhaps taking it off. And then you haven't had a long period of that high blood pressure damaging your body. But do whatever is necessary to keep you healthy.
So what actually is, I know you're saying high blood pressure. What is it in detail?
Okay, what do you mean, as in what is the number, or what,
No,
what does it mean?
high blood pressure.
Okay.
Is it your blood or to do with pressure in wounds? Right.
Thank you very much for asking that, because this is the kind of thing that as a doctor we say things and we don't realize whether people have understood what we're saying. So, so if you think about a syringe and the plunger and the syringe. So if you've got oil in that syringe and you push the plunge, the oil moves nice and smoothly. Okay. If you've got concrete in there and you try and push it, it's a lot harder. So if you think about concrete as when there's high blood pressure and it just, you're needing that extra effort to get blood around the body. So high blood pressure means the blood is needed, there's extra pressure needed to get that blood around the body, because for some reason something's happening in the syringe that's causing that. Okay, so it may be because of it may be because of disease to the blood vessels, it may be because of cholesterol and other things, but there's something that means that there's extra pressure needed. And we'd all prefer the syringe that goes in nice and smoothly. Does that make sense? Does that kind of give some sort of illustration? Yeah. Okay, so we want it to be flowing nice and gently.
What's the difference between the top number and the bottom?
So it's to do with, so it kind of monitors what the heart is doing. Blood is constantly flowing through your body, because if it stopped flowing, then blood wouldn't be flowing through your body and you wouldn't be here. And so when the heart pumps the blood out of your heart, the pressure needs to be really high. And then there's a period where the blood just flows back into the heart, and then it pumps it out, and then it goes back into the heart. So it pumps it out, and then it goes back into the heart. So the top one is the pressure when it pumps it out, and the bottom one is the pressure when your heart is relaxed. So the most worrying one is the top one. That if your blood pressure is going to 200, that's really too high. But also it's concerning if even at rest your blood pressure is high. So that's why both of them are important, but we're most worried about the top one, because that's the one that makes us worry about things like brain attacks and strokes.
Thank you.
Okay. It's really nice to be able to talk to people for more than 10 minutes. That's so my next slide. I was really ambitious in terms of what I wanted to talk to you about. I really, really passionately want people to understand about maintaining their health and how to look after themselves. So I'm a GP, but I was initially a gynecologist and looked after people with period problems. I put this down as what I wanted to talk to you about, but really in terms of period problems, there's a myriad of problems. And really in terms of period problems, compared to what I've been talking about all the while up to this point, there's nothing you can do. And probably what I'd say to you is that if you have a period problem, speak to your GP, okay? One thing I would say though, if your periods have stopped for a year and you get another bleed, speak to your GP urgently, okay? But this probably isn't the place to be talking about more detail about period problems, if you're all happy with that. Or is there anybody who has any specific questions? I could have done that, but it just it was a difficult thing to talk about. I realized that actually it would start being too medical, and I really didn't want to be too medical. I really wanted to be able to say, I want you all to go away feeling you've learned something, and this is something that's going to benefit your personal health. So as I said, my prayer for you is that you live a long and healthy life.
Thank you.
Usually give people a gift.
It's not chocolate,
It is.
That's so rude of you.
Well, I'm not going to blame Sister Grace, but she said us English women bring flowers, buy a box of chocolates.
Do you know, but the thing is, it's similar to what I'm saying about the alcohol, is that we all need to change our culture. We
Yes.
need to keep thinking about how we help each other.
Yes.
Because
Well, give them away
I
then.
love chocolates.
But that's just,
thank you
yeah,
very much.
to appreciate what you've been doing
Thank you
this
very much.
morning. Okay,
Thank you very
all
much.
right. Oh dear.